Hello, and thank you for joining us for our Medical Minute. I'm Ashley Daniels. Joining me today are two members of UAB Medicine's Orthopaedics. If you will both introduce yourself and tell us a little bit about what you do here at UAB.
Yeah, my name is Elie Ghanem. I do mostly hip and knee replacements, first-time surgeries, and redo revision surgeries for different complications and reasons.
My name is Amit Momaya. I'm a sports medicine surgeon here at UAB. Here at UAB Orthopaedics, we provide a comprehensive set of services for common and complex musculoskeletal problems. We provide both surgical and non-surgical care. We also utilize cutting-edge research to help improve our patient outcomes.
Great, thank you both. As far as specialties, you both have different ones. Tell us a little bit about those and any advancements that you think are important.
Sure, in sports medicine, we have the privilege of partnering with a lot of local high schools, UAB Athletics, and our professional Legion soccer team. We're always working on ACL prevention strategies and improving our techniques to help ACL outcomes. In addition, we do a lot of research on platelet-rich plasma injections and stem cell injections to help those with joint pain.
With respect to hip and knee replacements, we've come a long way. Patients are now pain-free, almost pain-free after the surgery. They're consuming less opioids after the surgery as well. We have a good same-day surgery program for certain patients that meet certain criteria. You have your surgery in the morning, you can go home in the afternoon. It definitely has improved over the decades as well.
That's great to hear. If someone out there is thinking, maybe I need to make an appointment, how do they do that? Do they need a referral?
That's a good question. It depends on every patient about the referrals. We can help you out if you want to call 975-BONE. That's again 975-BONE, and we can go from there.
Okay, great. Thank you so much. Also, you can visit uabmedicine.org for more information. This has been our Medical Minute. We hope to see you next time.
Today's Medical Minute was brought to you by UAB Medicine.